Good morning, everyone. I'm Meg Disler. I'm the director of the St. Joe Community Health Foundation, and we have the privilege of kind of facilitating the prenatal and infant care network. But, really, this is a network of about 70 different agencies and many, many professionals and committed volunteers and caring, compassionate people who really care deeply about new families, women, pregnant women, new fathers, infants in our community. And so thank you all for joining us. We have a wonderful program today, and it will be, as you all know, because that's why you signed up for it. But one of the things we had hoped to do in person, and I'm sorry we're not meeting at the library like we had wanted, but we wanted to err on the side of safety again with this COVID issue. But we do want to hear what's going on in your different agencies. So I would like to do two things. I'd like to ask you guys to put in the chat your name, but also your agency, and feel free to put any kind of announcements in there, things that are upcoming fundraisers, new programs in writing. And at the same time, if you have any kind of an agency update, new staff, again, new programs, shift in anything going on, I'd like to kind of open it up and ask you to please unmute yourself and share what's going on in your agency so we hear all the good work going on in the community. So anyone who wants to jump in, I'm just going to tell you to please go ahead and jump in orally, but also to do it in the chat box, please. See, this is what I really miss, having everybody in person where we can pass the mic around and see how you're doing a little bit more nicely. And hopefully we'll be able to do that in November.
Meg, would you like for us to just jump in?
Please do, Kim. That'd be great.
Wonderful. I'm Kim Trombley. I'm the new executive director for the Shepherd's Hand Community Outreach Center. And we just recently had our back to school health fair, and we are gearing up for our trunk or treat October health fair, where we will be doing a diaper giveaway. At our back to school health fair, we supported people from 10 different zip codes and 100 families with diapers. And then we also provided book bags and activity bags, early literacy bags. But we are gearing up, and then we also have 2 mobile diaper events coming up on September 11th. And we're also doing a healthy eating, active living class starting in September. So it's nice to meet everyone. I'm looking forward to hearing more from all the different agencies here.
Kim, can you also please go ahead and just make sure you put in the chat box your link so anybody can follow up on those good events and those 10 zip codes that you're focusing on. Just that'll help people link clients to those services.
Thank you.
Hi there, this is Stacia Roth from A Mother's Hope. And Emily Field is our family support manager, and I believe our case manager, Tasha Lyman, is on here too. We don't have any real big announcements, but we've definitely been very busy at A Mother's Hope. We've definitely seen an increase in applications in the last couple of months. And if any of you aren't aware of what A Mother's Hope is, we are the only maternity home in Allen County and any of the surrounding counties. And as a maternity home, we house pregnant women who are experiencing homelessness. So if you have any women that you're working with that are either homeless or at risk of homelessness, please send them our way.
I'm Amanda Chappell. I'm our program manager for Covering Kids and Families here at Bright Point. We do a Medicaid and Marketplace applications and support to help people maintain enrollments if they're already enrolled. But we have a drive-through community baby shower happening next Wednesday, and we do still have some time slots available. We've received donations from throughout the community to put together bags of just information for new moms, pregnant moms, but also some goodie bags. So any mom that registers for a time slot will get a nice goodie bag. It's a very nice diaper bag with a bunch of different things that have been donated from different organizations. And then they'll get a resource bag that has just information on a lot of the resources that you guys provide. So I'm going to put the link to our event registration in the chat. And then contact information is in there, I believe, for the person that is in charge of that. But if you haven't been contacted and you want your resources in there, feel free to reach out to me and let me know. And I'll get you connected with Rachel so we can get that all put together for next week.
Sounds great, Amanda. What a creative way of doing a baby shower. I like it.
We'll see how it goes. It's our first one, but we're having it down at Trinity English, and Rachel's done a really great job to set up kind of how it's going to flow and how it's going to work. So I know we have enough space for 36 moms.
Well, I'm going to move us forward at this point then to the program that you all registered to actually hear. And we kind of have our theme today is really empowering parents. Empowering new parents, in particular, two categories around doulas and PIC counts. And we've got great people with great local expertise in this to share further, who are here available to help strengthen all of our programming. But we're starting to add to a lot of our PIC luncheons a better connection to the work that's going on with the Allen County Fetal Infant Mortality Review Committee. As they're coming up with findings, research, and data, it's helpful for all of us to know what are patterns, and we have a marvelous lead of that. So I'm going to turn it over to Erin Norton, who's the Director of Community Outreach at Parkview Women's and Children's Service Line, and she's also the facilitator for the Allen County Fetal Infant Mortality Review Committee. And Erin, can give us a kind of a snippet of some information that will be helpful for everybody in here to be aware of. Yes.
Okay, very good. All right, well, thank you so much. So yes, I'm Erin Norton, and I coordinate the Allen County Fetal Infant Mortality Review. For those of you who aren't familiar with this group, it is a multidisciplinary team. We meet about 8 times a year, and it is sadly as morbid as it sounds. We look at individual cases of when a fetus or an infant dies to try to determine a couple of things. First, what are the protective factors? What was going right as a community, as different, everybody representing all different disciplines? What are we doing right for these families? And then we also look where our opportunities are. And then after we review a lot of cases, we start to notice trends, and we develop recommendations from those trends. So the first 2 trends that are the only 2 trends we're going to talk about today, and I selected these because they have been predominant over the course of many years, and they directly relate to the topics the other speakers are going to talk about later this afternoon. The first is that women are not always really advocating for their own needs. And the second is that women don't always recognize the signs of preterm labor or changes or decreases in babies' movement. And when they do, there's often a delay before women act on these things. So the overarching trend of things that our FEMUR team has observed is that women would really benefit from some increased support. They often minimize their concerns because they don't want to be a burden. This is really heartbreaking when we're interviewing moms, when we hear this, is that, even if they recognize something or think something might be wrong, they don't want to burden other people. They would rather shoulder those concerns alone, and often it results in bad outcomes. And women should be encouraged to listen to their bodies and bring concerns forward without delay. We never want women to feel like they're burdening any of us. If there is a concern, we want to know. So next, our recommendation is that we really want to help women. Our team really believes that women would benefit from developing better advocacy skills. And so, of course, all of our FEMUR cases are de-identified. We don't share any personal information, but I have pulled some examples of some of the things that we actually hear from women in our community. My doctor deserves a weekend too. It was after hours, so I just waited. I called first thing when the office opened on Monday. So I would hate to be a phone nurse who worked Monday mornings at 8 a.m. And then I didn't want to be that annoying patient. I think there is some lack of realization that physicians and providers have, there's a system set up for 24/7 access to provider. It might not be your own personal doctor you talk to, it might be one of their partners, but we really need to help women understand that just because it's 5 o'clock on a Friday, you don't need to wait till Monday morning to get help. If you're afraid that you're experiencing signs and symptoms of preterm labor, or if you feel like your baby's not moving. So some suggestions of things that I believe all of us here in the PIC network can do when we're working with families is to help women understand that your healthcare provider wants to hear from you if you think something is wrong. We'd much rather hear about these as doctors and nurses at the beginning than when it's too late. The sooner the better. It's always better to get something checked out and find out that everything's okay than to not get it checked out at all. You know, I think some women are hesitant to maybe go into triage because they would feel embarrassed if they got turned away. Please help women understand that it's not a big deal. Like, that happens, so what? You know, if you get sent home because everything's okay, fantastic. Everything's okay. Focus on that good news. It's nothing to be embarrassed about. And that you're not bothering anyone. You're no trouble. We want to help you. We're here to support you. We want you to have a healthy baby, and we want you, mom, to be as healthy as you can be. And then also include support people in education and conversation. Our team has also noticed that times when women do seek help quicker, it's not because they've decided it on their own, it's because the father of the baby or grandma or a best friend has weighed in and they've shared, I didn't know for sure if I should come in or not, but my mom just insisted. My mom insisted I come in. So we know that a lot of times those support people are really influential. So let's include them in our education about how women should definitely, if they feel like something's wrong, they should get that checked out. And then the second recommendation is that we want to encourage women to listen to their bodies. I hear things like this, or our team hears things like this. I couldn't have been in labor. I was only 24 weeks along. Women don't even realize that a baby could be born so soon, or even if intellectually they know it, they don't feel like it could be them. And this also goes across all education levels. We've seen women with less than an 8th grade education and women with doctorate degrees. It really isn't about how educated you are in general. It's just about taking some of the objective, first of all, knowing what the recommendations are, and then learning to respond to those when they're affecting you. It's easier, I think, and I'm guilty of this as a nurse, where if it's happening to somebody else, I could identify it, but if it's happening to me, I question it. So we really need to support women in listening to their bodies and advocating for themselves. And then this was my first baby. It felt just like I imagined labor would feel like, but it was too early. So, you know, another disconnect there. And then I just didn't feel right. Something was off, just some kind of vague feeling like of impending doom sometimes that women will verbalize. And then sometimes if my baby wasn't moving like normal, but I still felt some movement. And we know that just the laws of physics, if you've got, you know, a 6 or 7 pound baby inside you, an object in motion, you know, will stay in motion. And so there might be some kind of bumping around that you feel in your uterus, but if it's not those typical movements that you feel, that's a concern. That's something you need to get checked out right away. And so what we would recommend everybody in this group do is educate women about the signs and symptoms of preterm labor. It doesn't have to be real complex, and this is a link to just a short video that tells women what to look for and what to do. And then also encouraging women to pay attention to your baby's movements and how your body feels. And if something doesn't feel right, get it checked off. And I know the other speakers are going to go more into this. I won't spend a lot of time on that. And then lastly, unrelated to the remaining speakers today, is that I want everybody to be aware that our community has seen an increase in deaths related to unsafe sleep. So we all need to continue to be vigilant, making sure that women and families are educated and supported so that we can reverse those trends. I'm hoping it's not, I hope it's just a blip, let's put it that way. But it is something that other communities are seeing in the state as well when I've checked with my other femur colleagues. So I'm not sure if it's related to COVID or quarantining or any of these other things, but we just need to not let this trend continue. Thank you very much.
Thank you, Erin. And thank you, actually, everybody who's volunteering on that team for the work, because I know it takes quite a few hours to read those case files, do the work behind it to try to listen carefully in the community. Let me go ahead and introduce our next speaker. And our next speaker is a great expert on doulas, Shanna Bradley. Shanna is the executive director of a brand new nonprofit here locally called Journey Birth and Wellness. And she's going to answer that question, what is a doula? And present a lot of specialized evidence-based birth trainings and certifications that are going into professionalizing the role of doulas. She'll address the doula's role in empowering new parents to build their birth plan, as well as how they support them in labor through the actual birth of the baby and postpartum. Shanna personally is a wife, a mother of 5, and is trained in multiple doula programs, the DANA and the ICEA doula programs, and holds certifications from Still Birthday and Global Birth Community, as well as birth and bereavement doula certifications. She has also added to her resume childbirth educator and is finishing her training as an evidence-based birth instructor. And she is an international doula trainer. So she's got incredible expertise. She also holds a degree in intercultural studies and is currently working on her diploma in international maternal and child health. She, fortunately for all of us, returned to Fort Wayne several years ago and started this new nonprofit, Journey Birth and Wellness, to provide doula services to help local underserved populations, especially those living in neighborhoods of high infant mortality. Journey Birth and Wellness was born to train up women from different communities and cultures to support their own sisters, neighbors, friends in birth support and education. In its first 2 years, they've already trained some of the area's first doulas of color and the first bilingual doulas. And they have people who now are doulas who can speak not only English, but also Spanish, Korean, and Thai. So it's a great resource for the community. So with that, Shanna, I'm turning it over to you.
All right, thank you. I'm going to share my screen. All right, so I'm going to go over what Journey Birth and Wellness is, what we do, and what is a doula. So Meg touched on some of this, but I'll go back over it. Journey Birth and Wellness exists to train and equip birth professionals from diverse backgrounds to come alongside of women from their own culture to educate, support, and build community to empower these women during their pregnancy, labor, and into motherhood. We believe that this support can contribute to reducing infant and maternal mortality. So that was a big key factor of why we started right here in Northeast Indiana. So how do we do this? So one of the things that we do is doula services. So through a generous grant from the Community Health Foundation, we are able to now offer doula services on a sliding scale. And we also offer free services to immigrants, refugees, and teen moms. So locally, a doula is around $600 to $1,000, probably on average $700 to $800 to get a doula on your own. So doulas have been seen as a luxury for birth, and they have not been easily accessible to everyone, especially the communities that are underserved and marginalized who are highest at risk. And so through this generous grant, through St. Joseph, we are able to now make doulas accessible. And so that's why we're working on community education so that they know that we are here and we're ready to support them. The second thing we do is offer free childbirth education. We are doing that in person at the Shepherd's Hand Community Outreach Center that Kim was talking about earlier. This is on the southeast side on South Anthony. And what makes this different than other childbirth education is we currently have childbirth education offered by the specific hospital. So if you're birthing at a specific hospital, you can attend their online classes, but there's a lot that's just hospital specific. So related to what to expect at this hospital versus not always able to get all your questions answered of pregnancy and postpartum and things like that. There is one class offered. It's an 8 or 12-week class series in the Fort Wayne area. They are between $250 to $300 for this class series, and they expect you to show up every single Saturday. And so this, again, offers accessibility to childbirth education for these women to get that support. We have a breastfeeding support group that we just started on Wednesday mornings at Connect Allen County, which is where you can also find our office. So this is from 10 to 11 in one of their group rooms so that women can come and find community with women in the same stage of life, get some of their questions answered, get continuous resources and referrals. If they need more help, we generally refer to the lactation specialists at DuPont, Tina and Sarah. But this is just a way for people to get more of that support and community. We also offer doula training conferences, classes. We want to train these women from these different communities to be doulas and childbirth educators, so we offer that, as well as we have an annual birth conference, and we offer basically a monthly training from local experts and bring in other professionals to be able to provide birth education for our doulas and other birth professionals in the community so that we can continue to grow our skills. So what is a doula? A doula is a woman who comes alongside of another woman during pregnancy, labor, and postpartum to offer continuous support physically, emotionally, educationally.
I think we've got her frozen for a minute. We'll see what we can do with that.
Okay, next slide. So what makes this different between a midwife or a nurse or a spouse or husband, a friend, is that we are professionally trained to know what birth is, what birth is supposed to look like, but we do not do medical procedures. We don't do heart tones. We don't do vaginal exams. We're really there to support the mother herself in those 4 pillars. All right, next slide. So the first is physical support. So what does that look like? So comfort measures reduce pain. We help them through 1 contraction at a time. We help to reduce just the pain of labor altogether. We help them to get into different positions, to keep moving, to stay hydrated. We can do this also through massage, hip squeeze, counter pressure, rebozo techniques, spinning babies techniques. These are all different things that we physically do where we hands-on approach that's non-pharmaceutical to be able to support these women through labor. The next is emotional support. So we're also been called birth coaches or mothering the mother. So we come alongside, we encourage, we coach, we can coach them through breathing, we can coach them through contraction. We show compassion, reassurance, this is normal, you've got this, and really providing that emotional aspect that sometimes a sister or a husband or a boyfriend can't do. We had a client recently who came to us. She was a teen mom. She had been kicked out of her home for being pregnant. And she contacted us and she knew what she needed. She said, I need a mother-like figure. I need someone to hold my hand. I need someone to just hold me during some of this. And so we connected her with one of our doulas. She's actually a grandma and she is mother of all mothers. And this young girl had such a great experience and she was so thankful to have that motherly support during her labor. So the next is educational. So we offer education because we know knowledge is power, and empowering these women to know their choices so that they can make the best decisions for themselves and their babies. And we do this through the childbirth education class series, the breastfeeding support group. We do in-home prenatals and postpartums to be able to provide that information. We give evidence information as well as community resources and referrals so that we don't have the answers to all the questions, but we will help them to get that. And the last one is advocacy support. So this is helping them find their own voice, which is what Erin had talked about as well. And we do that through giving them information, helping them to understand informed consent. We use the BRAIN method, which I think a lot of you are familiar with. So BRAIN, benefits, risks, alternatives, intuition, and nothing. What if you do nothing? So we give them this tool so they can process some of the things that happen during labor when it's not the best time to be making decisions and having to think when you're, you know, in and out of pain. And so giving them this to practice so that when the doctors come in and say, hey, we need to do this, or can we do that, they have a way to process that. And that is new for a lot of our clients. Knowing what their options are. So helping them understand possible interventions. So again, when those arise in the hospital, they're not confused or blindsided. They understand that this was a possibility and they've already been able to think about it and discuss it. Knowing what to expect. A lot of our clients are immigrants and refugees, as we focus heavily on that. And so a lot of them have never been in a US hospital. So they have ideas, but they don't know what to expect. So we do encourage them to do a hospital tour so that they can reduce some of that anxiety and unknown. But we also want to help them to just know this is what it looks like when you go into triage and then get moved to, you know, labor and delivery and postpartum and things like that. We give the evidence-based information. So we use evidence-based birth, and this is an organization that takes all the scientific research, medical journals, all the studies, and puts it in an easy to read, usually one sheet piece of paper to get unbiased information of just the facts. So we provide that information so they can, again, make the best decision for themselves. And our goal is to help them, again, like what Erin was saying, to have that voice and to know how to speak up. So advocacy is so important because 1 in 3 women experience birth trauma. And birth trauma comes from one of 3 things or a multitude of these things. But basically it comes down to they want to know what's happening to them or what is, you know, going on. 2, they want to have a say. They want to be able to have a choice and make an informed decision. And 3, once they make that decision, they want that decision to be heard and understood. So our advocacy is to help them to be able to have that communication with their providers and the hospital, but not to speak for them and not to get in the way of that communication. So that comes to why we do our advocacy, which is the next slide. So this is the respectful maternal care, the universal rights of childbearing women. And these are globally, internationally recognized 7 rights. And so there's 2 of these that we really touch on, but this is where our advocacy part comes from. So number 1 is the freedom from harm and ill treatment. 2 is the right to informed consent or refusal, the respect of choice and preferences, including companionship during labor. So this is a big one. COVID changed everything. And so our hospitals are currently allowing support people as well as a certified doula. And so this comes down into 2 to be able to have that support that they choose and allowing support people as well as doulas with them during labor and postpartum. Number 3 is confidentiality and privacy. 4, dignity and respect. 5, equal freedom of discrimination, equal care. 6, timely health care and the level of quality health care. And 7 is the other one we touch on, which is liberty, autonomy, and being able to have freedom of coercion. So that's where some of the doulas in our area outside of our organization and around the US really come into conflict, where they stand between as a buffer to speak on behalf of people. And that's where there's an issue. And so we want our clients to understand informed consent so that they don't have issues with coercion, but that they can speak for themselves. And as an organization, we want to be completely transparent and work with the hospitals and staff so that we are part of the solution, not causing extra conflict. So that comes to our scope of practice. So what is a doula? How do they work? There can be some confusion there. And so we have continuity of care. So we offer continuous care from pregnancy, labor support, and into postpartum. We're a familiar face that they get to see, which is we're the only people that get to say that. So when you have a provider, you usually rotate through different providers, and then you get whoever is on call. So we're the one person that they choose that they know is going to be there at their birth. And so on average, statistics say that you see 6.4 new faces when you go into labor and delivery. My last client had 13 new faces. She had 8 different nurses, 3 different providers, and 2 different anesthesiologists, all before the baby was even born. And I was that continuous support person, that continuous face that she saw. And that all starts over when you move into postpartum. And so we get a baseline of how did these women feel, how did they act during pregnancy, as well as postpartum, to be able to catch some of those things when you have postpartum depression and other issues. And so continuity of care, nurses are also statistically only in and out of the birth room about 1/3 of the time. So about 33% of the time. So the other 2/3 of the time, these women are laboring alone, and some of them alone. And so we want to come in and be able to provide that support that's just continuous. Evidence-based birth, we touched on that. Again, we provide the information, but we do not give medical advice. And so what that generally looks like, if they have a question about a procedure or a practice or options, we go to the website, we give them the unbiased information, but we don't give them any kind of medical advice, but we do refer them to their medical providers for additional information. We provide support and community. So again, we do the one-on-one prenatals, giving them a safe space. We also have the groups and the classes so that they can feel confident and not feel alone. And part of the birth team. So again, with the advocacy, we are seen as birth professionals and we are part of that birth team. We are working with the staff, the providers, the hospital, not against them. We want to work and have continuity of care so that we can do the best support and education for our clients as a group. Journey Birth and Wellness is more than happy to give our scope of practice and our ethics and work alongside the hospitals so that we're not in conflict, but that we're in agreement so that we can support well. Again, we know that there are several doulas who have caused issues in some hospitals and staff don't appreciate doulas. So we would love to change the narrative on that and be open for communication so that we can do the best for maternal care in Fort Wayne. Next slide. So what does the evidence actually say about doulas? So they decreased C-section rates by 39%. So that's a huge one. So you are way less likely to have a C-section if you hire a doula. They decrease the low 5-minute APGAR score by 38%. They increase spontaneous vaginal birth by 15%. They decrease dissatisfaction of birth and birth trauma by 31%. They decrease the use of pain medication by 10%. I will say doulas support all births. So we support scheduled C-sections, emergency C-sections, home births, hospital births, birth center births, water births, epidural births, unmedicated births, and everything in between. We are there to support their choices, not our own preferences. So we are just there to completely be unbiased support. And this is another one people really love. Doulas reduce the time of labor and in labor by an hour or more on average. They also increase successful breastfeeding and length of how long women breastfeed, as well as decrease postpartum depression. So there's never been any negative outcomes from having a doula. The only setback for doulas is the financial responsibility. Again, coming up with that $1,000 per se to have a doula at your birth, which again, that's what we love about our community, is being able to make this accessible to everyone in Allen County. So Medicaid reimbursement. So this is a big one that's coming. So currently there are 21 states that have legislation on doulas through Medicaid and or private insurance. Even large corporations such as Walmart is jumping on board. They see how great doulas are. And so Walmart has a pilot program in the state of Georgia now that they reimburse for doulas for all of their employees. And hopefully that will roll out to the rest of the states soon. Nike a few weeks ago sent out an email campaign on doulas reducing maternal mortality, especially among the Black community, and had a whole campaign about Black doulas. And so these big corporations are jumping on board. Indiana is interesting. So about 3 or 4 years ago, they accepted Medicaid reimbursement for doulas. You can find that on different state websites, but it was never funded. So there's never been one person reimbursed. So the last several years, it's come back to the state and it's in process. Again, it's been approved but never funded. So it will happen eventually. There are 6 or 7 states that currently do, and Indiana is just in that limbo. And so all of our doulas are compliant with state regulations in the other states that do Medicaid reimbursement. So we are ready for when the time comes. We hold the proper certifications, et cetera, because we know it's coming. So we're excited for that. So training, certification, and continuing education. So one of the things that doulas aren't regulated nationally is through certification. So a trained doula, which is what most people were prior to COVID, because there was no need to be certified per se, now the hospitals are requiring, even locally, certified doulas only. So a trained doula attends an in-person training that's 16 to 20 hours or does some kind of online program. So they just learn the basic skills and information, but they don't necessarily align or are part of a larger certifying organization. So in order to do that, you have to continue your education with passing exams, reading books, doing different assignments, community resource lists, papers, usually attending births, and going through a whole process of becoming completely certified. Our doulas are certified, and some of them dual certified as well, with an international organization, which we're super excited about. Continuing education, we actually are a little different. We require all of our doulas to take an annual bloodborne pathogen training. We just see it as an important thing as they're working within the hospitals and working with families to protect them and their loved ones. And so all of them have up-to-date bloodborne pathogen trainings. We also offer, again, like the monthly trainings, bring in different professionals, offer conferences, things like that, so that we have our doulas continuing growing in their training education, which isn't, again, something that everyone necessarily does around here. So what does Journey Birth and Wellness offer to the local community? Again, we offer the doula services on a sliding scale, the education and support, the classes in different ways for the women and families to get together, and the doula training, which is what we're super proud about, which we'll talk about in the next slide. So doula services, we have 2 prenatal visits. We do in-home, and then we support them in-home in early labor and then go with them to the hospital. And then we do 2 postpartum follow-ups. So a normal doula in the area that you would privately hire usually does 1 postpartum. We do 2 postpartums, and the reason for that is we want to give that continuous support. You go to 12 to 15 prenatal appointments, you only have 1 postpartum appointment, and on average, 50% of women don't attend their one and only postpartum visit. We always encourage our women to go to their postpartum visit, and we have a 100% rate for all of our clients going to their one and only postpartum visit right now. And so we do want to see that extra support when Medicaid drops off, when postpartum depression is highest. So we do continue to add that support. What I was going to say is that we have, like Meg said, we have 12 doulas. We have the only bilingual doulas. We have doulas that speak Spanish, doulas who speak Korean and Thai. We're working on a training coming up where we'll have Burmese speaking doulas, and we have some of the only doulas of color working currently and supporting from within their own community. So we also offer the 6-week childbirth education. We're also working on developing some of our doulas into childbirth educators so that this information is coming from within their own communities as well. And the in-home one-on-one education that provides a safe space for them to ask more intimate questions that they might not ask in a group. The breastfeeding support group, again, is at Connect Allen County Wednesday mornings from 10 to 11, so they can get that ongoing support as well, because we know how important breastfeeding can be. And the doula training, so we are community-based doula training. Our doulas can also take on private clients outside of our organization as well. So this just touches on the things that I just talked about. But we do see that now that we're in the community more, doing booths, doing community outreach, especially within the Black community, they're excited to see Black doulas. They're excited to learn that they can get this additional support, and they're more open to taking this information from people who look like them, who speak their language, who live within their cultures. This is true amongst the Burmese Korean community as well. So referrals, who and how? So we work with different providers. We work a lot with the Parkview Randalia midwives because they're in the areas in which we serve those communities. And so we even have been on call for them and come in and supported women who were birthing alone and really struggling during their labor and built relationships that way. So we are more than happy to spend more time building relationships with other providers. Community resources, we've worked and had referrals from a Hope Center, a Women's Care Center, Healthier Moms and Babies, Young Lives, churches, and other organizations like that. So we would love to also build more of those bridges there. And outreach and social media. We get a lot of referrals when we do our booths and from social media as well. So we kind of get an equal amount of referrals from different places. We have doulas that are more than able to and available to take more clients currently. And you can do that by emailing us or having your clients email us through journeybirthandwellness.org, calling us, or even they can find us at Connect Allen County at Rudisill Plaza. So coming up, these are our big classes and events. So we have a 6-week class series for childbirth ed that starts September 13th, Monday nights from 6:30 to 8:30 at a Shepherd's Hand. We have the ongoing breastfeeding support group Wednesday mornings at Connect. We have evidence-based birth professional workshops coming this fall for Savvy Birth 101 for professionals, as well as labor and delivery comfort measures for professionals. And we are holding a birth trauma intensive seminar in March of 2022 to really get the community involved in the conversation of how do we reduce birth trauma and reduce infant and maternal mortality rates. So let me know if you have any questions. Thank you so much for letting me share about doulas.
Oh, thank you very much. Shanna. I thought I knew a lot, and I think I learned a whole lot more. So thank you. We thought it'd be helpful. We heard a little bit of how others are working with them, referring. What is the difference of bringing in a doula to come alongside your team of community health workers or your other professionals on your team? So we're going to put Jackie Martinez on the spot a little bit. She knows we're asking her this. But how is Healthier Moms and Babies, with your work over there, when do you refer? What is kind of the role of your staff, and how do you collaborate effectively with doulas to complement your services?
Well, I just want to thank Shanna. I actually really learned a lot myself. But I think to answer that question, Meg, I don't think it's either one or the other, but in addition to, it's how I like to see it. Because here at Healthier Moms and Babies, we do more, the difference that I see is more long-term services, where we are in the home as soon in the pregnancy as we can be, and throughout the pregnancy, and then throughout, anywhere up to 18 months, and then for our NFP program, 2 years after. And so, or the baby's 2 years old. So that is one of the biggest difference is the time. So, and then also we do a lot of wraparound services. We really also touch on the social determinants of our mothers and really get them connected to the resources that they may need, they have in need, whether that be utilities, insurance, food, anything that could be going on in their social life, to really make sure that that pregnancy has the best chance at being a healthy pregnancy and a healthy outcome. And then by referring or by having the great services of our doulas is when we see a client that has really a huge lack of support, we don't go into the hospital. We don't offer those type of services. So whether they don't feel comfortable with the support that they have, or they have burned so many bridges, because a lot of the clients that we deal with unfortunately have been through addictions, and addictions can be very damaging to a lot of relationships. So they find themselves pregnant and with no one around. That to me is almost heaven sent, to be able to call these ladies and say, hey, they don't have anyone, but they could really use the extra support. We can't go in and do the services that you provide. Please come alongside us and help, our clients, and be a support to them during their labor and delivery journey. So I know that our, actually one of our nurses, I know that she had 2 in mind, and I think 1 actually is working with the ladies already. So we're definitely identifying those that need that extra support for their labor and delivery. And then the postpartum, that's huge, because that's just one more person in the home. That's just one more support touch point for that mom. And we can get some of those things across that Erin was talking about. we asked about the preterm labor signs, or like Shayna said, you only have one postpartum. So now all of a sudden we're in the home, they're in the home. So now all of a sudden they have like 3 people in the home at postpartum. So the more arms that we can get wrapped around our moms, I think the better chance we have to really be a support, positive and effective support to that mom actually. So I don't know if that answers the question, but I think my thing, and Shayna, you can agree or disagree, is the longevity, how many touch points we have, and then the fact that they're able to go and actually be physically present for the labor and delivery journey.
Yes, for sure. So doulas aren't super long-term. Again, we might meet with them for an hour and a half to 2 hours several times, but it usually ends in that first 1 to 3 months postpartum. And a lot of the times women don't know that they want a doula until the end. And so we might not get called generally until the 3rd trimester. So for those women who need more than just that support in the labor, we definitely refer to Healthier Moms and Babies because of what she just said. Yeah, having that continuous care for a much longer period of time.
Again, I keep learning. So this is wonderful. If there's any questions, I want to open it up for Q&A. And I also, let's do Q&A, and then we want to survey the group so that we get some feedback from all of you, what you're learning, what's helpful. So with this kind of programming. Does anybody have any questions they want to put out there now, or you can feel free to put it in the chat. We do have one question in here from Maria Charland that says, what requirements are there to become a doula?
Yeah, so there really aren't. It's mostly, do you want to support women during birth, and are you okay with everything that comes along with that? So we do have applications, and we take doulas when needed, and then we train them in-house, but we have a huge community of doulas in Fort Wayne. You can check out the Doula Network of Fort Wayne and find out, like, I would say we have 50 plus doulas, private doulas in the area. So there's nothing specific. You can start from scratch. There are a lot of people that come and they have background in as being a nurse, being L&D, or a lot of women are just, hey, I had my own babies and I want to see the support for other women, but there's no actual criteria. Anyone can be a doula.
I want to give you a little more just feedback from the chat. We do have one of the doulas, Janisha Beal, who says, I absolutely love being a doula with Journey Birth and Wellness. My favorite part of it is the relational aspects of supporting emotionally during their most vulnerable times. Lara Lair has indicated that she is a midwife at DeKalb and Auburn Birthing Center and has worked with Journey Birth and Wellness doulas. It said that they are amazing and a gift to the community, and she is thankful for the sliding scale that they offer. We've had another couple of compliments in here. Cora McKenzie put out there, as a labor nurse who's worked with Shayna's doulas at a delivery recently, she says that she had only positive things to say about the support that was provided. Thank you very much. So lots of love coming through the chat right now. I think there was one more question from Maria Charland to bring in more doulas of color. And if you could circle back on that for a second, Shanna, that might be great. How to encourage more women of color to become doulas.
If Janisha actually wants to answer that, that would be awesome. Janisha, what do you think?
I think just, being able to just get the word out. I don't know. To me, I just think we need to tell all, and just, a lot of people don't want to be a part of a network where there's a breakdown in the systems too. So I feel like me being a doula of color, I'm able to get out there and be like, no, I'm building these relationships with these awesome people, like come alongside me while I do that. And I guess just building the trust and me being able to, the doulas that are on Journey Birth and Wellness and the doulas of color that are in the community, just being able to bridge that gap of trust and, you know, kind of just getting people out there and just bringing more awareness. Most of my clients are teen moms, and they're teen moms of color. And, you know, just breaking down those barriers, because I just recently had a client who's, I think her brother was on the phone with her, and he's like, you got a doula? So you got money, you rich? And I'm like, so this is where I plug, where I'm like, you don't have to be rich to have a doula. And so I just spent like 20 to 30 minutes explaining to them, and they're young and they're like, wow. You know, so as also a Young Lives coordinator, where I'm able to go into these schools and speak about the importance of doulas. So I feel like that's my outreach, by going into the high schools and bringing awareness to doulas, because a lot of people who are young, they don't know. So I feel like if we reach the young people, we'll be able to, you know, broaden their horizons to what a doula is as well. And then they'll pour that more into the community. So just being able to go into schools and speak more about it.
Thank you, Janisha. That's some great feedback. Going to stay on the program a little bit here. Thank you all for participating in the survey. That helps give us feedback, and we'll share the results of that. Further encourage anyone to feel free to reach out to Shanna. And, you know, can you put your email in the chat for anybody who wants to pull it too, to follow up with Journey Birth and Wellness? Again, all of these presentations we will be putting up on our website, and a recording of this. So as you've got colleagues who are not able to participate and you can share what a great presentation this was, they can easily click onto it at a convenient time for them and get this good information. Now, the next part of the program, we really felt it's important to help empower parents to understand what are kick counts and tracking in utero movements. And Jackie Martinez, who you just heard from briefly, who is the programs manager of Healthier Moms and Babies, is really one of our local experts on educating expectant parents to track their baby's movements, especially in that third trimester of pregnancy, empowering them when to speak up if there's a change in what's normal. The importance of that, as Erin shared with us at the beginning. And so I'm going to turn it over to Jackie to give us an update on everything kick counts and how do we empower parents around kick counts.
Okay. Okay, so what are kick counts? Okay, thank you guys. Kick counts, also known as fetal movement counts or fetal activity counts, are the number of time your baby kicks, twists, turns, moves, punches you. You really can't tell whether it's a kick sometimes or whether it's a punch, or they're just swimming around in there. But nevertheless, is the time that you're feeling your baby moving within your pregnancy. So why should we do kick counts? So this presentation, I made it as in how we talk to our clients. We just very straightforward, very simple. This is a way that you can keep your own baby safe, like you yourself. Counting and tracking your baby's movements really helps you start to get to know your baby's habits and the patterns, and really kind of gives you a sense, like Erin says, if something changes or something's way different, that something might be off. Therefore, you're able, because of the monitoring that you've been doing, because you have recognized these habits and these patterns by doing kick counts, you're able to notify your medical provider, your OB, when something you think is off and could really make a difference in your pregnancy. also getting in tune with your baby movements is a really great way to start the bonding process. And I think that's a time, I don't have it in here, but that we really insert reading to your baby, as your baby is moving and active, you think, okay, let's read to baby and, have our baby's attention. So that's why we really educate on the reason why they should do kick counts. So then they ask, but when? Many people start feeling little flutters and little what they think might be movements very early on. But between 16 and 22 weeks gestation, they are pretty subtle and irregular. Some might think, is this gas or is this the baby? I know that many of us that have been pregnant, that's been a question of many. We really do hope it's the baby, but sometimes it could just be gas. So really, we start educating to really be in tune with your body and with your baby's movements as early on as 16 weeks, because it could really vary. But during the third trimester, really around 28 weeks is when those kicks become stronger and more predictable and very noticeable. Like you will know it's a kick or a punch or a movement as opposed to maybe gas. So really, a good time is really any time that you can find in your day to be consistent about it. So really they say set aside time apart every day, roughly around the same time, for example, at bedtime. And or because you've been doing it, choose it when your baby's most active and your baby's supposed to be active because that's been the pattern. So that's when we tell them to do the kick counts. And so then it comes the question of how to. So the disclaimer we always give, because we always let our clients know that your medical provider, your physician really should be your biggest advocate on some of the things during your pregnancy. Like our visits don't take your place of prenatal care, and our education that we do, if you ever doubt anything, you still should, talk to your provider. So really talk to your provider. If there's a certain reason why they want you to be extra cautious and really monitoring your baby's movements, because that's unique to your pregnancy or to what's been going on throughout their journey, follow those. But really, one of the methods that we often use for most of our moms is how long it takes to feel their baby kick, move, swarm 10 times. So either they can lie down, that's why we say maybe at bedtime, or they can sit in a comfortable chair. And really, we do have a sheet. I should have brought a little so I could show you. We hand them a sheet on whether you just make a little check mark every time you feel your baby kick or move. And then you do that up to you feel 10 movements. That could take, whether your baby's super active, that could take, half hour, that could take an hour. Sometimes it goes over an hour, and sometimes our clients were like, well, is that normal? It is normal. You can count on to the second hour because they can be sporadic. But if anytime, normally they kick 10 times within the first hour. It's really, there's a decrease in movement. I can really tell that this is not what the norm is. That at the very least should suffice for a phone call to the OB. As Erin was saying, don't second guess yourself. Do not think that you're going to be this, annoying patient that's calling about kick counts. They're actually going to be very impressed. And so we really advocate our clients and or offer for ourselves to work really well with a lot of the nurses at the PPG Parkview office or Women's Health Advantage or wherever they may be going, where if they feel comfortable for us to reach out, we make that a point to reach out with them right then and there. But we really advocate for them because one of the biggest things we do tell them, just like anything, just like in preterm labor science, just like in kick count, they know their body best. If something does not feel right, trust yourself, trust your body and what it may be trying to tell you, and call your healthcare professional or provider. And so then another resource other than like the actual sheet that we give them with the kick counts and how to do them, why to do them, and a little check mark These are some great apps because nowadays that's what most people use and most of our clients use is one less piece of paper, and it's something that tracks their patterns. So if they think, oh, I don't know what I did with that sheet of paper or what happened last week, was this kind of the same pattern? The app will actually track patterns. A lot of these, actually most of these apps does. Kick Counter is probably my favorite. I actually used it. I recently had twins, and let me tell you, kick counts with twins. I really tried to figure out who was kicking, but now that they're here, I'm like, wait, I think I had the wrong kid the whole time. So it is really hard. If anybody has a different experience, please share, but I could not. I thought I knew, but once the babies were born and once, everything happened, I think I was quite the opposite. Actually, I think the one that I thought was my mover is my more calm baby, and vice versa. And all I did was I followed the same technique. I just made sure that when I knew that they were kicking, I would track their kick counts on my phone, and whoever was kicking, but I knew that it was the same type of movement. And really, that's what we teach them. That's why we teach them. It just goes the same thing as preterm labor signs. Be aware of your body, be intentional with being aware of what's going on, and be true to yourself when you feel that something is not right. You're your biggest advocate as well as your baby's biggest advocate. We're right there alongside of you, helping you, but know that, you're worth that. You're worth that phone call for someone to at least hear your concerns and most likely probably have you come in. So that's why kick counts are very important, because it is truly something that they can do on their own to keep their baby safe and or notify and catch something before something horribly goes wrong. So I know Meg has this. So, if you guys want these apps, these are the ones that we tend to use. And then we have a handout as well. If anybody has any additional resources, please feel free to share. And that's it.
Very good. Well, we're going to let you guys off 15 minutes earlier than we thought. And usually everybody likes an extra 15 minutes in the day, but it's great seeing many of your faces, and if not your faces, seeing your names on the screen. And we hope everybody's doing well. And thank you again, Erin, Shanna, Jackie, for sharing your expertise. Really appreciative of it. Have a great afternoon.